What if I told you that your age is not the best way to measure how well you're aging? You may be 60, 70, or even 80 years old, yet your body could still be stronger, healthier, and more capable than someone much younger. On the other hand, some people begin losing their independence long before they reach old age, not because of a single disease, but because they slowly lose the everyday abilities that keep them active. The truth is, healthy aging isn't just about adding more years to your life. It's about maintaining the strength, balance, memory, and confidence to enjoy those years. Many older adults focus only on numbers like blood pressure or cholesterol, but there are other important signs that reveal how well your body and brain are functioning. Today, we're going to explore 5 simple abilities that doctors and health experts often consider encouraging signs of healthy aging. These aren't secret medical tests or expensive health screenings. They're everyday abilities that many people overlook until they become difficult. Now, this doesn't mean that if you've lost one of these abilities, something is seriously wrong. Health changes for many reasons, and many people can improve strength, balance, and mobility with the right medical care, exercise, and healthy habits. The goal of this video is not to judge your health. It's to help you understand where you are today and what you can do to stay independent for as long as possible. So, as we go through each ability, ask yourself an honest question. Can I still do this comfortably? You may be surprised by what your answers reveal. Stay with me until the end because the 5th ability is often considered one of the strongest signs of healthy aging, yet many people don't realize how important it truly is. Welcome to Dr. Bilal, where we make medical information simple, practical, and easy to understand so you can enjoy a healthier, stronger, and more independent life after 60. Let's begin with the first 2 abilities that can tell you a lot about your overall health, strength, and future independence. Now let's begin with the first 2 abilities. They may seem simple, but together they reveal a great deal about your muscle strength, balance, and overall physical health. Ability number 1, walking steadily without losing your balance. Take a moment to think about your last walk. Did you feel confident with every step? Or did you need to hold onto a wall, furniture, or someone's arm for support? Being able to walk with a steady, natural stride is one of the clearest signs that your muscles, joints, nerves, vision, and brain are working together properly. Every step requires perfect coordination between these systems. As we age, it's common to walk a little more slowly, but frequent stumbling, shuffling your feet, or feeling unsteady should never be ignored. These changes may increase the risk of falls, which are one of the leading causes of injury in older adults. The good news is that balance can often be improved. Regular walking, gentle strength exercises, stretching, and balance training may help maintain stability and confidence. Even a short walk every day can make a meaningful difference over time. If you can still walk comfortably without feeling unstable, that's an encouraging sign that your body is continuing to support your independence. Ability number 2, standing up from a chair without using your hands. Now, here's a simple test you can try at home. Sit in a sturdy chair with your feet flat on the floor. Without using your hands for support, slowly stand up, then sit back down again. If you can do this comfortably, it usually suggests that your leg muscles and core strength are still working well. This movement may seem ordinary, but it reflects something extremely important. Every day, you stand up from a chair, get out of bed, use the toilet, and climb into a car. Strong leg muscles make all of these activities safer and easier. Difficulty standing up doesn't always mean something is seriously wrong. It may simply indicate that your muscles have become weaker because of inactivity, illness, or normal age-related changes. The encouraging news is that muscle strength can often improve at almost any age with regular exercise and proper nutrition. Remember, independence isn't measured by how old you are. It's measured by what your body is still able to do. You've already seen how balance and leg strength can reveal a lot about healthy aging. Now let's look at 2 more abilities that are just as important. These involve your brain, heart, and lungs, organs that work together every single day to keep you active and independent. Ability number 3, remembering everyday information and staying mentally sharp. Have you ever walked into a room and forgotten why you were there? That happens to almost everyone from time to time, regardless of age. However, healthy aging means your brain is still able to manage everyday tasks. You can remember appointments, recognize family members, follow conversations, manage your daily routine, and make simple decisions without constant confusion. Your brain is like a muscle. The more you use it, the stronger it can remain. Reading, solving puzzles, learning new skills, talking with friends, and staying socially active all help keep your mind engaged. Good sleep, regular physical activity, controlling blood pressure, and managing diabetes are also important because they support healthy blood flow to the brain. If you still feel mentally alert and can handle your everyday responsibilities with confidence, that's an encouraging sign that your cognitive health is being maintained. Ability number 4, climbing stairs without severe breathlessness. Now think about the last time you climbed a flight of stairs. Did you reach the top, feeling slightly out of breath but able to recover within a minute or two? Or did you have to stop halfway because you felt completely exhausted? As we grow older, it's normal to breathe a little harder during physical activity, but being unable to climb even a few steps because of severe breathlessness may deserve medical attention, especially if this is a new change. Climbing stairs is a simple way to challenge your heart, lungs, muscles, and joints all at once. If you can climb stairs at your own comfortable pace without chest pain, severe shortness of breath, or dizziness, it often suggests that your cardiovascular fitness and muscle endurance are still supporting your daily activities. If climbing stairs has become much more difficult than it used to be, don't ignore it. Conditions such as heart disease, lung disease, anemia, or reduced physical fitness may all contribute, and a healthcare professional can help identify the cause. The encouraging news is that many people improve their endurance through regular walking, strength training, healthy eating, and following their doctor's treatment plan. These two abilities remind us that healthy aging isn't just about living longer, it's about keeping both your body and your mind working together. So far, we've talked about balance, leg strength, memory, and heart and lung fitness. Now let's look at the fifth ability, one that brings all of these together and may be one of the clearest signs of healthy aging. Ability number 5, staying independent in everyday life. Take a moment and ask yourself a simple question. Can you prepare a meal, get dressed, take a shower, shop for groceries, manage your medications, or enjoy a short walk without depending on someone else for help? If the answer is yes, that's an encouraging sign that your body and mind are still working together effectively. Independence isn't about doing everything perfectly. It's about having the confidence and ability to take care of your daily needs safely. Every small task, buttoning a shirt, carrying groceries, climbing into a car, or getting out of bed, requires strength, balance, coordination, vision, memory, and healthy joints. This is why many healthcare professionals consider independence one of the most meaningful indicators of healthy aging. It reflects not just one part of the body, but how all of your body systems work together. How to protect these abilities as you age. The good news is that many healthy habits can help you maintain these abilities for years to come. The first is stay physically active. You don't need intense workouts. Even 20 to 30 minutes of walking, gentle strength exercises, or stretching on most days can help maintain muscle strength, improve balance, and support heart health. Second, eat a balanced diet. Include plenty of vegetables, fruits, whole grains, healthy fats, and protein to support your muscles and overall health. Staying well-nourished becomes even more important as we age. Third, keep your brain active. Read books, solve puzzles, learn new skills, play games, or spend time talking with family and friends. Social interaction and mental stimulation are important for cognitive health. Fourth, get enough sleep. Quality sleep gives your brain and body time to recover and plays an important role in memory, mood, and overall well-being. Finally, don't ignore changes in your health. If you notice new weakness, frequent falls, increasing forgetfulness, chest pain, severe shortness of breath, or difficulty performing everyday tasks, speak with your healthcare provider. Early evaluation often leads to better outcomes. Remember, aging is a natural part of life, but losing your independence isn't something you should simply accept without asking why. Let's take a moment to look back at everything we've discussed today. Growing older is something none of us can avoid. But how we age is influenced by many factors, including our daily habits, medical care, physical activity, nutrition, sleep, and the choices we make every day. Today, we explored 5 encouraging signs of healthy aging: walking with good balance, standing up from a chair without using your hands, staying mentally sharp in your daily life, climbing stairs without severe breathlessness, and remaining independent in everyday activities. If you still have these abilities, take a moment to appreciate them. They are valuable signs that your muscles, brain, heart, lungs, and nervous system are continuing to support your independence. That doesn't mean you're immune to aging or health problems, but it does mean you have a strong foundation that is worth protecting. And if you found that 1 or 2 of these abilities have become more difficult, don't lose hope. Many people improve their strength, balance, and endurance through regular exercise, healthy eating, proper sleep, physical therapy when needed, and by following the advice of their healthcare provider. Healthy aging is not about being perfect. It's about making small improvements that add up over time. Remember, you don't have to make dramatic changes overnight. A short daily walk, a few minutes of strength exercises, eating more nutritious meals, staying socially connected, and keeping your mind active can all contribute to a healthier future. These simple habits may seem small today, but over months and years, they can make a remarkable difference in your quality of life. Most importantly, listen to your body. If you notice sudden weakness, repeated falls, worsening memory problems, chest pain, severe shortness of breath, or any other concerning symptoms, don't ignore them. Early medical evaluation can identify treatable conditions before they become more serious. Your goal shouldn't be to fight aging. It should be to age as strongly, safely, and independently as possible. Thank you for watching Dr. Bilal. If you enjoyed this video and learned something valuable, please give it a thumbs up. Subscribe to the channel and turn on the notification bell so you never miss our latest evidence-based health tips for adults over 50 and 60. Share this video with a parent, grandparent, friend, or loved one. It might encourage them to stay active, protect their independence, and take better care of their health. Until next time, take care of yourself, stay active, stay informed, and remember, it's never too late to invest in your health. I'll see you in the next video.